Hi, my name is Yelena Ristic, and this is the first video that you're seeing of me speaking about prolotherapy, welcome to my prolotherapy channel called Prolotherapy in Perspective. The reason I've started this channel is because I went through quite an extreme, pretty epic journey um, that involved prolotherapy, but mostly involved injury, and I recovered eventually through prolotherapy. But I went through an extremely long process that started in 2009 and lasted the bulk of it until 2019. And I've gotten several different types of prolotherapy, and I have quite an extensive experience, personal experience with prolotherapy that I wanted to share with as many people as I can. The reason I want to share it is because in my own journey, and this is the topic of today's video, you can tell by the title, Does Prolotherapy Work? Of course, before I knew about it and I wanted to engage in it, my biggest question was, does it work? It is somewhat expensive. It sounds risky. It sounds invasive. And I use the word sounds on purpose because it really sounds, but compared to a lot of other kinds of treatments out there, it isn't as invasive or risky at all. I was frightened by the prospect of having to receive numerous needles into joints, passing things like nerves and going into ligaments and tendons. I wondered, of course, how much it would hurt. I wondered if it would be successful. I wondered if it was worth the money. And I wondered what it could do for me. And it did pretty much everything prolotherapy can do for anybody, which is not all good. In my case, it turned out fantastic, but I went through almost all the experiences through in my journey, almost all the experiences that I had heard about online. So I went into forums, probably like you've done. I went to social media, to Facebook groups about prolotherapy, blogs, doctor sites, YouTube channels, anything and everything I could find, but there's nothing that can replace actual experience. And I heard everything from don't ever do this, it will damage you, it doesn't make any sense, it's the worst thing ever, the people who do this are charlatans, to it's absolutely miraculous, I would be dead without it, and it gave me my life back. And I personally experienced both ends of the spectrum and a little bit of everything in between. So why? How does that happen? How can one treatment modality that's apparently approved to be practiced result in such a variance? How can some people say, don't ever do this? It gave me nerve damage, it disabled me, it crippled me, it made my pain 100 times worse, and someone else say, all my pain is gone, I have 100% functionality back, nobody else could help me, only my prolotherapist could, this stuff is a miracle, it's magic. My theory, again, I am not a doctor, so my disclaimer is I am not a doctor. I am just a person who has had extensive experience with prolotherapy. And I will tell you what I wondered those things. Looking at these sites, I thought, who do I believe? Do I believe the person who says that they got disabled by prolotherapy, don't ever try it? Or do I believe the person who said this is a miracle, do it, it'll change your life? So it turned out the way that my story unfolded gave me both the misfortune and the opportunity to experience being seriously damaged by prolotherapy as well as healed. So, and I mean miraculously healed out of a situation where I thought I would never ever walk again, where I was told that I would be disabled for life, to give up. There was no hope for me, and I was told by traditional doctors who don't practice prolotherapy that prolotherapy is bunk, it doesn't work, it's only temporary, it's a trick, and that I would be wasting my money that I should save to augment what was then what were then my disability checks. And I was told this straight out: don't do it, don't try it anymore, give up. And I didn't, because I kept, I had been put in the state where I was disabled by not just prolotherapy. I was originally, so I'll try to do a quick recap to give you context, but not to tell you the whole story because it's really long. Was injured in 2009, tried all kinds of chiro and physio that didn't work because I was misdiagnosed. It was wrong. Finally got the guts to try prolotherapy in 2011. The doctor that I went to was supposedly an amazing doctor, and I thought so too after my first couple of treatments, especially after my first treatment. Now here's the interesting part. I was short on money. So I had my first treatment, and it was a good, let's say 2 months, I think, before I could have my second. But this doctor had recommended every 2 to 3 weeks. I couldn't manage it. And within 2 months, I had what I thought was a lot of healing. My pain had gone down maybe 60-70%. I was in heaven, I thought, at that point, because I had been in awful chronic pain from 2009 to 2011 that absolutely nobody could help me with. I was in agony. I still had to go to work. I had a mortgage to pay. I was absolutely miserable. So when this first prolotherapy treatment gave me that much relief, my thought was, can you imagine if I did it according to this doctor's recommendations every 3 weeks, 2 or 3 weeks? I've waited 8 weeks. I need to step this up. So I stepped it up. And it was a huge mistake because, unbeknownst to me, he had misdiagnosed injuries. He didn't use ultrasound. He used what I have labeled the carpet bombing technique, where you just isolate the area that's injured by, that's where the pain is, and then give tons and tons of prolotherapy to that area, hoping to strengthen all the structures around it, and that the injuries will, even if you don't hit them exactly, you don't put the solution exactly into the tear, everything around it will get stronger. And it's a kind of like, excuse me, it's an approach where you're carpet bombing the area, you're figuring you're going to do more good than harm, probably a lot more good, and it'll heal spontaneously even if you don't get everything. And that can sometimes work. Honestly, it can sometimes work. And it worked to a certain extent. So then I wanted to make sure that I did exactly what the doctor said, and I started doing physiotherapy, occasional chiropractic adjustments, if I would go out of place, when I sort of overdid my activity for how much healing. It's hard to say because you can't see, you don't have a way to evaluate and mark, I've healed this much, therefore I can do this much more safely. It's a process where you have to test it out, and sometimes you overdo it, so you pull back. But sometimes you overdo it to the point where you put yourself out because your joints are lax and it's really painful. You don't want to be on painkiller, so you want an adjustment. And I was told it was okay to do, it was not okay, sorry, to do torque adjustments, so anywhere where your body has to be twisted and a pressure is applied. But it was okay to do like straight on flat adjustments. And I did a few of those. And what ended up happening is I had too many prolotherapy treatments too close together. So when I say 2011, my first treatment was December of 2011. My second one was March of 2012. And then I got a few more treatments close together. By August of 2012, I was no longer able to walk. And it was a combination of overzealous prolotherapy, carpet bombing type prolotherapy, misdiagnosis of injuries, and actually, because it was carpet bombing, that I believe, again, I don't have 100% proof, it's just through logical deduction, that the areas that were injured weren't 100% hit or always hit, or maybe sometimes not at all hit, but because of the carpet bombing technique that the doctor used, at one visit I had over 180 needles to my lower back alone. like my lower back and hip area, sorry, in combination. So about 100 to my hip and 80 to my lower back. They hit areas that were healthy, that needed to stay healthy and not be hit and not be weakened, because they were the areas that were preventing the original injuries from getting bigger. And I basically collapsed. By September of 2012, beginning of September, I could not go back to work. I lost my job and I couldn't pay my mortgage and I was disabled. So prolotherapy took me in that first instance from chronic, horrible, miserable pain and a very low threshold of activity to almost no pain, not a huge improvement in the strength that I had to do activities, into full-on disability. And there was nerve involvement as well. Nerves got inflamed and I was, basically it was so bad. It's uncomfortable to say, but I have to say it because it's the truth. I got to a point where I was suicidal. That's how much pain I was in. And for those of you who might have not seen past videos, the medications that I was on at that time, if you know something about medication, all of these happen to kill pain to some extent or another. Some are particularly from pain or for pain. I was on, at the same time, 150 milligrams of tramadol, 900 milligrams of gabapentin, 300 milligrams of Seroquel. I think I don't want to say it incorrectly because lorazepam is very strong, but the one dose, maybe 1 milligram of lorazepam. I know you can get it in 0.25 and 0.5, so maybe it was 1 milligram of lorazepam, which is high. A few milligrams of clonazepam for anxiety and panic attacks. That would just knock me out for a couple of hours, and 20 milligrams of citalopram at the same time. And I was still in enough pain that every moment of my life was miserable. And there were times when I would overdo it. It would mean I might try to put clothes away. I might try to pick anything up and carry it across a room. The most minimal things would put me in utter agony, and I would have to be in bed for 2 days on all those medications. Before I got on the medications, I was unable to get out of bed. I was unable, obviously, then to shower, dress myself on a scale, on a disability scale where 55 is basically quadriplegic and entirely unable to take care of yourself. I was a 50 out of a 55. So prolotherapy did that to me. Prolotherapy in combination with chiropractic treatments. The chiropractic treatments didn't help, but they most likely, I had gone through them for 2 years prior to that, and they had never done that kind of damage. They had done some damage, and I'll talk about that in another video, but never that kind of damage. So it was the combination. Put me in that state. How was I going to get out of that state? Logically, I would probably never go to prolotherapy ever again. I didn't want to go to prolotherapy again, but I looked for everything for years that I could possibly do, and the only one answer I kept coming back to was prolotherapy, and I kept reading how it got people out of incredible disability, sometimes 20 years of chronic pain, and that was their answer. And I started reading about different types of prolotherapy, differences in the way it was being administered, differences in solutions, and I did loads and loads of research. Unfortunately, I had to go through 3 more doctors, prolotherapy doctors, who were very good-willing, I think, who wanted to genuinely help, but just, again, they didn't use ultrasound. It was fewer shots, but still the carpet bombing technique, not hitting the exact injuries, not finding or hitting the exact injuries. The diagnosis wasn't completely correct, still. And the solutions used were not optimal for each different type of injury I had. At that point, I had ligament damage, tendon damage, muscle tears, tons of muscle tears, and a pretty significant, depends on who you talk to, but a significant enough labral tear to ruin the vacuum in that ball joint and cause me a lot of dysfunction and pain. It was a 3 millimeter tear in the 12 o'clock position. So there, I went through more doctors. I went through, again, same pattern, sometimes helped, sometimes harmed. And I just plateaued. I couldn't get off of painkiller. I couldn't reduce painkiller. I wasn't really getting anywhere. I'd get a little bit better. I think I was getting better, then get worse. Until finally, two different doctors, I kept searching and I kept trying. Two different doctors recommended the same doctor to me, telling me specifically, this man has a specialization in ultrasound. If anyone can accurately diagnose you and accurately treat you, it's you. It's him. And I had called over 20 to 25 different prolotherapists, and I'd gotten wise and started interviewing them, telling them my problem, telling them my history, paying the $200 sometimes for a consult. And if I didn't like the way the doctor had spoken to me after I had gotten some experience and knowledge, I chose not to go with that doctor. And in that process, two doctors, after speaking with me, recommended this one same doctor to me. And so I went to him, and here's the difference. Here's why I believe prolotherapy does 100% work. The correct kind of prolotherapy for your injuries, with the correct diagnosis, administered with a doctor who is willing to work very closely with you and troubleshoot and problem solve along the way, and will not force you to do physiotherapy until you're ready, will not make, as some doctors did for me, physiotherapy mandatory in order to get treatment because they believe that the treatment wouldn't be successful without the physio, and I might get the wrong idea about prolotherapy. So I went to this doctor and I said to him, there's no way on earth I'm going to do physiotherapy with the kind of injuries that I have. Can we make a deal that I'm not doing physiotherapy until I feel I'm ready? And he said it was okay, and he agreed. I had told him that I thought that some of my previous prolotherapy, plateaued, or I got hurt worse because the physiotherapy either wasn't correct or it was too much too soon. It was hard to know when it would be too much too soon, and I just didn't want to do any. I wanted the deal I made is when I'm off all pain meds, then I might consider physio. And he stuck to that deal. And I didn't really start doing any kind of physio until I got off. Actually, I haven't done any physio. When I say any kind of physio, it was my own exercises that I wanted to use for strengthening. I never went back to a physiotherapist again. And that'll be another video. So does prolotherapy work? Yes, it absolutely does work. Can prolotherapy cause miraculous healing? Yes, it absolutely can. So I went from the woman who could not put on a pair of yoga pants from pain on all the painkillers that I told you I was on, that could barely walk to the bathroom by herself, that was put on lifelong disability, permanent disability, that had lost her house, that had lost her job, that had lost her husband, and that had lost all hope of anything ever being better, to the woman who, as if you've seen my previous videos, I'm usually not this made up, just went out tonight actually, just a few hours ago, came home from hanging out with my friends who dance flamenco. So if you know what flamenco dance is, it's really hard on your body. It's a lot of high impact footwork. It's a lot of moving your body into very unnatural positions quickly to very rhythmic music. And I'm back to being able to do that. Not full force, not 100%. I have a few tears that I still have to attend to. Money and time being a little bit of problems to have gotten to them yet, but I'm fully confident that they will be addressed. And I am now 85 to 90% back to an absolutely amazing quality of life that includes pretty strenuous exercise, dance, being fulfilled in every way possible. I remarried. I have my old job back. I have more work. I have actually 3 jobs right now. I can handle having 3 jobs. I choose to have them. I teach. I love teaching. They also help with the little bit more prolotherapy I need and catching up with the financial hole this whole experience left me in. And I enjoy life to the fullest. So that's what prolotherapy can do. But again, the right kind of prolotherapy with the right doctor. And there are a lot of right doctors out there. I'm not saying that my doctor is the only right doctor. From what I can see, from what I've heard from other people, from what I've heard from my doctor, there are a great number of wonderful doctors out there. But there are a great number of doctors who might be very well-meaning, but they do not fully understand, do not do enough professional development, aren't rigorous enough, are maybe not also adequate enough diagnosticians. They've been informed by other specialists what your diagnosis should be. That could be wrong. They're trying their best. There are a lot of pieces to the puzzle to ensure that prolotherapy does work. So that is the video for today. I hope that some of what I've said has been helpful to you. I encourage all types of comments. I'm very open to any kind of critique that you might have of the way I'm doing my videos, how I'm doing them. I'm obviously going to keep trying to improve them and maybe make them a little bit more succinct. I do have a lot to say, and I am doing this extemporaneously because I find that if I try to go adhere to a script, I just sound like a robot, and that's not very friendly or accessible. So please, any kind of critiques you might want to give me, any information, if you want to challenge me on anything that I have said, I am happy to look into it and do more research and respond with also what I know. Any of your questions, I'm happy to answer. If you are interested in a particular topic for another video, please let me know and I'd be happy to address that too. I am on a few Facebook prolotherapy groups. If you'd like to reach me that way, you can find me on Facebook. And I hope, again, sincerely, that this has been helpful. Thank you very, very much for watching. I wish you all the very best in anything in your life, quite honestly, but most especially if you're a chronic pain sufferer. I wish you all the strength and courage and hope in the world. And if there's absolutely anything I can do to help, please, please, please reach out and let me know. That's all for tonight. Thanks again. Take care.